Welcome to our new videos. If you are new to our channel, please subscribe to our channel and hit the bell icon. The link to purchase the product is given in the description. Hepara-Cleanse. Ingredient information. Why are herbs? We only use organic or wild harvested herbs grown in North America. Organic herbs have been shown to be up to 10 times stronger than conventionally grown herbs. The reason we buy only from North America is that herbs from overseas are still grown with the use of highly toxic pesticides and insecticides, and many still use DDT. Many herb companies buy from growers in Egypt, China, etc., because they literally pay 50 to 60 rupees a pound for weak, dirty, unregulated herbs. Even if they claim to be organic, herbs from other countries are almost always irradiated in ethylene oxide gas chambers to destroy bacteria before being allowed into North America. Ethylene oxide gas has been proven to cause liver cancer in animals, destroy nerve cells, cause leukemia, respiratory disease, seizures, comas, etc. We pay anywhere from 1000 to 1850 rupees per pound extra for our herbs which are grown on certified organic farms or wild harvested right here in North America. We use only the strongest and cleanest herbs to ensure your pet will heal more quickly. Before using any herbal formula, ask the manufacturer where their herbs come from. If they can't tell, you might be endangering your pet's health by using them. Why are tinctured formulae? We make our formulae very strong. The reason we do this is we want your pet to get better. Many companies use only 10 to 20% herbs when making their tinctures, and the rest is the extracting liquid. The result is a watered-down weak tincture that is light in color and has at best a light taste if you can detect anything at all beyond the alcohol. We use a minimum of 90% herbs in our formulae and we let our formulae steep for 14 days. The result is a dark liquid that has a powerful aroma and taste of the herbs it is made from. The strongest tinctures you can buy at most health stores are rated 1-1, that means 50% herbs to 50% extracting liquid. Many herb companies think that's overkill. We think it's not nearly strong enough. When you are dealing with life and death situations, you need effective concentrated formulae that work and that is exactly what we offer. Hepara-Cleanse. Ingredients: milk thistle seed, gentian root, dandelion root, Oregon grape root, wormwood leaf and flower, Mojave Chaparral herb, black walnut hulls, ginger rhizome, and fennel seed. The liver's job is to cleanse the blood of any impurities such as those found in processed foods, tap water that is loaded with chemicals, the polluted air we all breathe. They congest the liver and in turn the liver becomes less able to filter the blood. Over time, the poisons that your dog's liver should be removing get into the bloodstream and eventually lead to disease. Our liver flush cleans and protects the liver and is a lifesaver for dogs with serious liver disease. Hepara-Cleanse also removes parasites and intestinal worms. We have seen dogs with sinus infections, skin infections, and ear infections that recovered after only 1 month of kidney and liver flush programs. Once the liver and kidneys have been cleansed, it allows the body to focus its energy on healing the sick and diseased areas. So start giving your dog organic whole foods, clean filtered water, plenty of outdoor exercise, and cleanse his liver and kidneys, and you will see huge improvements in his health. All ingredients are either organic or wild harvested. Signs of liver disease in dogs. In the early stages of liver problems in dogs, the liver swells and enlarges. As the disease progresses, the liver cells die and are replaced by scar tissue. The liver then becomes rubbery and firm. This condition is called cirrhosis and is not reversible. Before the liver reaches this terminal stage, it can recover from damage and heal itself to the point where your dog has normal liver function. This is possible if proper treatment is instituted early on. The extent of recovery depends on the exact cause of the liver damage. 80% of liver cells must die before the liver begins to fail. Knowing what's normal for your dog will help you spot the signs of liver disease early. The early signs and symptoms can include lethargy and fatigue, low appetite, weight loss, drinking less or more than usual, vomiting or diarrhea, shaking caused by nausea or discomfort. Other signs may include digestive disorders such as constipation, gas and bloating, dry, brittle or infected nails, dull eyes, corneal or retinal disorders, jaundice, sinus issues, dark urine, ligament or tendon issues, irritability and aggression, seizures or fits, high temperature, a painful, bloated belly, spontaneous bleeding, pressing their head against things, ascites, hepatic encephalopathy, nervous system disorder, edema, swollen lower limbs. Many people mistake these signs as just a normal part of aging, but since liver disease symptoms are so varied, it's best to err on the side of caution and have your dog checked by a vet. Toxins that can be damaging to your dog's liver. A dog's liver works hard to break down toxins, and the more it is exposed to, the more likely it is to experience damage. A dog's liver can become stressed by numerous toxins, including vaccines and medications, flea and tick pesticides, heartworm drugs, dewormers, pesticides and herbicides, food additives, environmental toxins, processed foods, viruses and autoimmune diseases, flame retardants in furniture and flooring, chemical cleaners, destructive to the liver, hepatotoxic, and excess exposure to heat. Necrosis, tissue death, sets in, with loss of liver enzymes and impaired liver function ultimately leading to complete organ failure. Acute liver failure also occurs due to extensive metabolic disorders in protein synthesis, albumin, transport protein, procoagulant, and anticoagulant protein factors, and glucose absorption, as well as abnormalities in the metabolic detoxification process. If this condition is not treated promptly, it can result in death. Stages of dog liver failure. Liver disease in dogs occurs in 4 stages. 1. Abnormal inflammation is the first stage of this condition, and this can be treated with medication or dietary changes in most cases. 2. The second stage is fibrosis, which occurs when the liver begins to scar and harden. When liver disease is caught at this stage or before, it can be reversed. 3. Cirrhosis is the third stage, which is characterized by permanent scarring to the liver. 4. The fourth stage of liver disease is liver failure, at which point the dog's liver can't function properly. At this stage, The main goal will be to make your dog as comfortable as they can be in their final weeks or months. Livers are regenerative, so if liver disease is caught early enough, dogs can recover and live a happy, healthy life. But in severe cases, your dog may require more intensive treatment, and in extreme cases, liver disease may even be too advanced to be treated. What signs and symptoms will you notice in a cat with liver disease? Some signs are strongly suggestive of liver disease, most notably jaundice, which appears as yellow discoloration of the skin, eyes and mucous membranes, and ascites, which appears as swelling of the abdomen due to buildup of fluid. These are often accompanied by less specific signs that can be quite variable, including lethargy, changes in appetite, excessive thirst and urination, weight loss, bleeding disorders, vomiting, and diarrhea. These may be the only signs noted in some early or mild cases of liver disease. Unfortunately, jaundice and ascites can be signs of diseases in other body systems. How is liver disease diagnosed? In mild or early cases of liver disease, the signs are often relatively nonspecific, and further diagnostic testing will be necessary to identify its presence. Since the liver is responsible for such a diverse range of metabolic functions, there is a wide range of blood and urine laboratory tests that may be useful to assess liver disease and function. Radiographs, X-rays, and ultrasonography will demonstrate any changes in the size or appearance of the liver. What about a liver biopsy? A wide range of disorders may affect the liver, resulting in abnormal liver tests. One of the chief limitations of blood and urine tests and non-invasive imaging techniques is that while they may indicate the presence of liver damage or dysfunction, they cannot indicate the cause or potential reversibility of the problem. In some cases, a biopsy of the liver will provide a specific diagnosis, which will help your veterinarian determine the most appropriate treatment and an accurate prognosis. In some cases, a biopsy of the liver will provide a specific diagnosis, which will help your veterinarian determine the most appropriate treatment and an accurate prognosis. The small sample of liver tissue may be obtained by introducing a biopsy needle through the skin directly into the liver, via fine needle aspiration, or by means of an exploratory surgery. A number of factors will be considered by your veterinarian in order to determine which method is appropriate for your cat. These may include the disease process that is most likely, and whether an exploratory surgery may provide the opportunity for treatment as well as diagnosis. Your cat will require heavy sedation or general anesthesia so that the biopsy sample can be safely obtained. There are some risks associated with anesthesia, sedation, and biopsy, and the risks may be slightly increased with some forms of liver disease. Fortunately, in most cats, the risks are relatively low, and the technique can be performed safely and without any significant complications. Dosage: Hepara-Cleanse 1 drop per pound of body weight to be given with blood cleansing tonic. Given 3 to 4 times daily for 1 week. Welcome to our new videos. If you are new to our channel, please subscribe to our channel and hit the bell icon. The link to purchase the product is given in the description. Thank you for watching this video.